All right, everybody. Hafa Health is the segment. I'm Jason Salas. Welcome back to the show. And I welcome back to the segment in the KUAM News Zoom Room, Dr. Andrew Graves. He is a board certified radiologist and the department chair over at the FHP Imaging Center, way in the center of the island in Tamuning. Doc, so good to see you again and welcome back to the show. Always good to have you.
Thank you, sir.
Okay. Yeah, well, there has been, I would dare say, and I remember the last time you and I were talking on this very program. There's a fair amount, I guess, right? A fair amount of radiology work that goes into Guam or by Guam practitioners like yourself for a variety of things. So, maybe just give us some context and everything and say, what type of work do you typically see as a radiologist in say like a garden variety week?
Okay, that's a good question. At FHP, we offer a wide array of imaging services. So that includes things like CT and MRI, both very powerful imaging tools. Our MRI machine is a 3 Tesla magnet. So that's one of the most powerful MRI magnets that we have on the island other than the Navy. We also have a brand new CT scanner from General Electric, which is right behind me. And we highlighted
the big donut.
Yeah, the big donut. That's not a green screen. That's actually our CT scanner. And that does high quality imaging work and a lot of specialty examinations. We have ultrasound, a full complement of ultrasound services. And then we offer digital mammography and digital x-ray. And those digital modalities, digital x-ray and digital mammography, offer high resolution, efficient imaging that's state-of-the-art, cutting edge. And it represents a commitment from our administration and the staff here to continue to upgrade our equipment and keep it at top-notch, cutting edge. And digital mammography is one example, and digital x-ray is one example of that commitment.
Mm-hmm. Now, as a radiologist, Doc, what do you tend to look for when you talk to a patient or, like one of your colleagues says, okay, well, you would probably be candidate for some radiology or x-ray treatment, everything, either, preoperative, postoperative, like that. I know there's a million different use cases and everything like that. But as someone who does this kind of work for a living and everything, when you're going through the scans, what do you typically keep an eye out for?
That question's pretty broad.
Yeah.
But
abnormalities, I would say, right?
So when you get an imaging examination, before you get the imaging examination, it starts with a patient encounter, a patient coming in and seeing a physician and being evaluated. So that might be in the urgent care, that might be with your oncologist, that might be with your primary care doctor. So when you come to when you come to FHP and you bump your head, or maybe you're getting managed by the oncologist for cancer, that they will guide you towards an imaging study that you perform here in the clinic under the same roof with all the conveniences of not having to travel somewhere else. And you also have those benefits of the collaboration between the physicians, where I can walk down the hallway and talk to your urgent care doctor and say, that belly pain, that pain that's right down there in the right lower quadrant of the abdomen, that's acute appendicitis. It's not ruptured. Let's take the next steps to get a surgical consultation. Or maybe it's me walking down the hallway and talking to the oncologist and saying, things are getting worse. Maybe there's a role for changing up the chemotherapy, or maybe adding radiation, or just changing the approach. Also, with those conversations can be communicating emergent results. Maybe there's complications related to therapy. And so I can very quickly just go over there and tell them, hey, there's something that needs your attention immediately. You need to act on this. And so that convenience, that collaboration, all the imaging services under the same roof really lend itself to quality care.
Gotcha. Yeah. So I think you hit the nail perfectly on the head. Very, very broad services. You obviously oversee a variety of services under radiology. And I wanted to ask, Doctor, because Guam is such a sports-centric community, and because of our climate, you can play a variety of athletic activities year-round. How many services that you provide and everything like that have to do with maybe athletic injuries or athletic conditions?
Yeah, sure. That's a good question. Um, we get referrals from our orthopedic surgeons and our primary care doctors with regard to sports related injuries. So you might be dealing with an injury of your shoulder or your knee or your hip, and you're looking to diagnose things with high resolution of the soft tissues. So you would be getting an MRI of your knee or your shoulder, and you're looking at injuries to ligaments, tendons, special cartilage structures, whether that's the cartilage lining the joint, or some of the specialized cartilage like menisci or labrum. And so, for if you mentioned tennis, you're a tennis player, you're your rotator cuff. You would get an MRI. We would diagnose that, characterize the extent of the injury, and that information would be relayed to a surgeon for surgical planning. Or maybe the imaging affords you the diagnosis that it's not as bad as we thought, and that you don't need surgery, and that you will likely recover and return to your athletic abilities with physical therapy and medical management.
Man, 12-year-old Jason just like was so happy hearing you say that, because when I broke my wrist, it was actually like not only a physically traumatic experience, but mentally I had to go and have like an X-ray done, because they wanted to see, it wasn't a compound fracture, so bone did not break skin, but they wanted to see, to what extent, my radius bone was in fact broken and everything. And I mean, maybe I'll stay in my my immature years and everything, and probably ask you a question that I'm sure patients, young and old, ask you. It's like, doctor, if I need to get an X-ray, does it hurt? And how is radiology technology maybe like advanced over the years? Is it any faster than it used to be? I would assume it probably would be. And I've heard people say, if anything, it's loud, but by no means painful.
Sure. It's not uncommon for me to encounter phobia around coming to see doctors and then getting imaging. And those can be rooted in a lot of different things. But when you come to the radiology department, you're getting pictures taken, whether it be an X-ray or a CT scan or an ultrasound or an MRI, that these are not painful imaging procedures. You don't experience any pain whatsoever. No more painful than when you have to take that family photo with, at Christmas time or Easter or whatever the vacation
Probably
is,
less
right?
so.
You have, but when you come in here, we have a very efficient system at the clinic to make sure that when you come for imaging, that you're safe with regard to COVID. So we have the screening protocols at the door to make sure that we're keeping this as a safe environment, that you're not worried about getting COVID while you're getting your imaging. You very efficiently get checked in with my staff at the front desk. And then, like for instance, for X-ray, you were talking about your wrist. It's a walk-in basis. There's no appointment. We take you in right away, get you an X-ray. And I often read it. Sometimes I read it before the patient even leaves the department. But I have a commitment to reading things fast. I like to have a fast turnaround time. And part of the efficiency within our system is that as soon as I sign off my report, our system automatically faxes it to your provider. And if you're seeing a physician here, like you fell on your skateboard, you broke your arm, or you think you broke your arm, you went to the urgent care, then I just walk over and I tell the urgent care doctor, yep, it's broken, it's not displaced, it's not angulated. And I'm telling them all the important things that says, okay, we can just immobilize this and treat this as a routine fracture. It's not going to require something like open reduction and internal fixation.
And as you said, and I think you made that point very beautifully, like when it comes to maybe more acute situations, like, somebody has appendicitis and everything like that, turnaround time is unbelievably critical.
Yeah, absolutely. And so having the efficiency of having a full complement of imaging services under one roof in close proximity to the urgent care and your primary care doctors and your oncologists, it makes for a very convenient and efficient medical experience.
Mm-hmm. There are also specialty services that that you and your colleagues provide. Can you talk about those for a little bit?
Yeah, so there's probably not enough time to talk about all the specialty examinations that we do here, but Probably
You guys are
one
basically rock stars.
well, there's a lot of exams that we offer here that that are geared towards providing the tools for our specialists on the island, whether it be orthopedic surgeons or urologists or ENT or general surgeons. But one area worth highlighting is in cancer imaging. So we offer specialized examinations like breast MRI, prostate MRI, both powerful imaging studies to help diagnose cancer early and aiding in the detection, but also aiding in surgical planning and sometimes in the follow-up in response to treatments. We also offer specialized examinations in the setting of colon cancer, which are geared towards pre-surgical planning. We offer specialty examinations like 4D ultrasound, where we do 3D, high resolution 3D ultrasound imaging of your baby in the womb in real time, watching your baby do things that babies do, like suck their thumbs. And you get to see detailed imaging of the facial structure, their nose, their lips, and a lot of the fun conversations that the mom and dad have right there at the bedside as they're looking at the imaging. Baby looks more like dad, baby looks more like mom, maybe there's a little bit of a disagreement. And at the end of all that, we give you a thumb drive where you have your imaging and you have those videos as keepsakes to keep as memories and put in your baby book.
I've been fortunate. I've seen many of those 4D images, and they are, breathtaking. Is an understatement. I mean, they are unbelievable.
Yeah, and it's the 3D, and then the fourth dimension is the time. So you see your baby doing things that babies do, and that's so powerful and impactful when you're seeing all those human characteristics in real time. Maybe some of the other exams, like last time we were talking about lung cancer screening. Mm-hmm. And so we have our new GE CT scanner behind us, which does high resolution imaging of the chest at low doses to diagnose cancer at its earliest stages to maximize cure and treatment. And with all those specialty examinations, our clinic has been committed to, with the support of our administration, to buying high quality imaging equipment from General Electric. This is a tried and true vendor that has a quality product that produces extremely high quality imaging and state of the art examinations.
Absolutely. Give us maybe some historical perspective on your profession, Doc. Because how long? I mean, obviously, the use of technology has been a big part of modern medicine, and probably even back to the early days of medicine. There's always been tools and techniques used to treat a patient. How long has radiology actually been a part of the treatment process?
Well,
I'm taking you back to med school here, so.
Yeah, one of the main reasons I got into radiology is because of its the way that it's impacted medical services and for decades. And I saw a vision of how technology was going to drive medicine, and imaging, the ability to diagnose things early, accurately, sometimes without needing surgery, but also following response to therapy, that was always going to stay at the forefront. It was going to be cutting edge for medicine. And so radiology has been here for decades, and it's continued to be a driver in improving quality of care for patients in all realms, sports related, cancer, and acute related illnesses like we talked about with acute appendicitis.
Sure. Can I ask you to talk about that wonderful piece of machinery, since you were talking about GE and the fine work that those folks do over your right shoulder, Doc? And I know maybe in earlier incarnations of radiology machines like that, it was kind of like maybe like a big box or an enclosed space, and people would kind of develop like this claustrophobic trigger even just looking at it. But I got to tell you, just the fact that it's an open on either side and everything like that actually makes it very, very comforting. Do you find that to be the same with like other patients when they just look at it? It's like, okay, it doesn't seem so scary anymore.
Yeah, and you can't see in the imaging, but there's a lot of things that we've added to it. Like on the roof here, we have it's an image of a blue sky with white clouds and a palm tree. So you lay down on the table behind me, and then you look up, and then that's actually a picture of the Guam sky right outside of our clinic, looking at one of the palm trees. So there's some things about the aesthetics of the room that we're very deliberate about to help make it a comfortable experience for patients. We understand that there's anxiety, which we talked about earlier in the conversation, going through the tube. Something that's important to highlight with this machine is that it takes the imaging very, very quickly in a fraction of a second. So you can take an image, like say of your lungs, in a single breath hold. We'll tell you, hold your breath, and then you're going right through the tube and right out, and we already have the imaging. So in those people that have some degree of claustrophobia, we achieve the imaging very, very quickly. And it also has the benefit for pediatric patients where there's a lot of intimidation with regard to the imaging equipment to be able
kids,
to be able to take the images quickly and efficiently. And with that quick acquisition, we're able to minimize any kind of motion artifacts or degradation of the imaging that can be associated with patient movement. That's can be rooted in anxiety. So we deal with a number of pediatric patients that come here, like maybe to the urgent care. Your baby falls, or your son or daughter falls, hits their head. They go to the urgent care. We want to know if there's a problem. Did it injure something inside their head? Is there bleeding? Then they come. It's just a short little trip down the hallway. Maybe 35 feet down the hallway. You're on the table. Mom can be in the room. We can give her a leaded vest. She can hold son or daughter's hand to comfort them. And we have stickers on site, so we'll give kids stickers, all kinds of little different tools and tricks of the trade to distract them, to comfort them, to make it the most comfortable experience as possible, all while maintaining that efficiency and the convenience.
So it really is a combination of, in this case, like man and machine providing, the best quality of care, for the patient to achieve the result.
Absolutely. And so like a vendor like GE, they continue to put out quality products that are at the forefront of technology, and they're efficient. They have high quality imaging that they produce. They afford the flexibility to do specialty examinations. And then within our clinic, I commit myself to training, and my staff are committed to training in making this a comfortable experience. And some of those things are as silly as handing out a piece of candy or maybe a sticker, but also being able to talk about educating the patients about their experience, what the modality is, what they're going to be experiencing, how fast it is, how efficient it is, and what the benefits are. Understanding the benefits of your examination really enhance the cooperation from the patient.
Gotcha.
Understanding that there's a team effort, and part of that team is actually the patient and their cooperation with our instructions and the processes that we have here.
Gotcha. Okay. Final question before I let you go. This is absolutely fascinating. Doctor, this is a wonderful interview. What are maybe some services or some types of component or elements along the treatment life cycle, if you will, that you provide as a radiologist, and maybe some people, surprise some people and everything, and then they're like, oh yeah, we'll get you better and everything like that, but we got to take a couple X-rays, or we're going to send you to to Dr. Graves for a CT scan or something, and people never really knew that. It's like, oh, I just got a headache, or something like that. What's some stuff that really surprises people?
That's actually a good question to highlight, because people often know that you can get imaging studies here. You could get pictures with X-rays and ultrasounds and CTs and MRIs. But one of the areas that people are the least educated about are the services that we provide with regard to minimally invasive image-guided procedures. These are procedures where we harness the power of the imaging modalities we have, like the CT scanner behind me, or our ultrasound machine, to do a number of procedures. These are like small outpatient surgical procedures. They don't require anesthesia. They're done with local anesthetic. You leave with a Band-Aid. You don't need stitches. So these minimally invasive procedures, the imaging studies allow us to do it without having to have all those things that you would expect with an operating room. And so some of these procedures are like cancer biopsies for cancer diagnosis. We use ultrasound guidance to biopsy the breast, like a breast mass for breast cancer diagnosis, to diagnose nodules within the thyroid for thyroid cancer diagnosis. We use the imaging studies for pain management. We can use those to guide a needle into a joint to deliver a steroid for the relief of pain, and to augment things like physical therapy and maybe non-steroidal anti-inflammatories and the rest and the ice and the things that they tell you.
You're preaching to the choir here on that one, Doc. Yeah, absolutely.
Yeah, like, my mom. Want to get back on, oh, sorry, go ahead.
No, please.
I was going to say, so that when someone like yourself wants to get back on the tennis court because your shoulder's acting up, we can go ahead and give you a steroid injection under ultrasound guidance, and that can work in conjunction with some of the other medical therapies that you'll be doing with your doctor or a physical therapist.
I was going to say, and as a, not necessarily as a direct patient, but as a caretaker of a patient, my mom actually had a sciatica treatment, and it was a combination of radiology and the actual shot into the sciatic nerve that got her, completely like back on track.
Absolutely.
So I am, I'm basically buying whatever you're selling and everything like that, because, you guys got my mom like back in tip top shape. So for you and your colleagues and everything like that, I owe you guys everything.
Well, it's one area where we often experience a high level of patient satisfaction, right? Because they get back to the things that they want to be doing. Some of those are daily activities of life, but other ones are their activities of recreation, like the tennis or the kiteboarding or surfing or whatever it is. And then lastly, we do image-guided drainage procedures. So it might be draining areas of infection where there's a pocket of pus, or it might be draining abnormal fluid collections that may surround your lungs, or might be inside your belly in patients that have cancer, or they might have organ dysfunction like heart failure, liver failure, or kidney failure. So under ultrasound guidance, we can drain these fluid collections to improve patient comfort. Occasionally, we drain the fluid collections for diagnostic purposes. So if it's an effective fluid collection, we can send that to the laboratory. They could do specialized tests, gram stain, culture sensitivity, to find out what kind of bacteria that you're dealing with, to make sure that the antibiotics are geared specifically to kill that bacteria. Occasionally, as we drain off this fluid collection, we might send it to the laboratory to see if there's cancer cells within
Gotcha.
it. And in the process of working up a cancer diagnosis.
Yeah, Dr. Graves, I have learned so much today, and I can't thank you enough, because it's been such a revelation for me to not only know that radiology and X-ray technology, something I've always been fascinated with, is not just for very extreme cases and everything like that, but it's actually been used in the modern day, with in day-to-day, almost commonplace treatment and everything like that. But the one thing that obviously hasn't changed is it's all about getting the patients better and helping to save lives.
Yeah, absolutely. Radiology is an integral part of your medical therapy, and we're ultimately we come alongside your providers, your urgent care doctors, your oncologists, your surgeons, to provide that guidance in diagnosis and response to therapy, so that you get well, you get the best therapy possible, you get the appropriate surgery that you need. So.
Okay,
Thank
so normally,
Jason, I appreciate it.
Well, normally at this point, I would typically say, like, if patients or just curious residents watching this right now, if they have questions, where can they contact you? But are you kind of like along the treatment chain where people contact you directly, or they talk to their primary physician and then they would make a referral to you? It kind of sounds like the latter in most cases, right?
Most of the time it involves working through your primary care doctor or an urgent
Gotcha.
care doctor or one of your specialists. In the case of breast cancer screening, I typically, because I will be your doctor with regard to screening mammography and then guiding workups in response to things I see on mammography. In that context, there's a lot more communication going on because I'm seeing you longitudinally from the screening examination to maybe more specialized mammographic images to maybe ultrasound to maybe biopsy, right? So along that spectrum, there's more communication between me and the patient. But one of the things that I afford patients, there is always an opportunity when they come in to get imaging, they can always come to my office, talk to me about what the imaging is, what do I see, what do I think the next step is, to review, to actually lay eyes on what the pictures show. You often hear about these things in medical terms, but it's helpful to be able to visualize it and put up to an image to the words that you're hearing that your doctor is talking about. So there is that opportunity for them to come and ask questions and to learn about what it is that we're doing here and how it's integral to their medical care.
And maybe we can conclude on that and everything. The machines that you use and the techniques that you apply are extensions of yourself. So maybe even for some people, you know, the devices might be a little intimidating and everything. There is a human being who is a learned expert that really cares about you and that is going to take care of you and get you back on track.
Yeah, absolutely. And not only an extension of myself, but the whole radiology team.
Sure.
The techs and the management and everybody being very deliberate about the way that we organize our department, from the moment that you check in to having a smiling face to having an efficient process to get your imaging, and to making sure that there's efficient processes for you and your physicians to receive the reports and the information necessary to guide your therapy.
Understood, doctor. And I said it once and I'll say it again. Like I said, you guys are rock stars. So like that's the easiest way to put it. Well, Dr. Andrew Graves down at FHP, thank you so much for what you do for our island community. And, thank you for taking care of everybody. We know we're in good hands with you guys.
Thank you, Jason. Thanks for having me on.
All right. Have a good day.
Thank you for watching this video from Take Care and FHP Health Center. For more videos like this one to help you live a more balanced lifestyle, please subscribe and like our social media pages. And don't forget to turn on the notifications. For more information about Take Care and FHP Health Center, please go to takecareasia.com.